Hello, welcome to this educational video series and how you can incorporate yoga techniques within your hand therapy practice. In this first video, we'll cover what yoga is and why I developed this capstone project for hand therapy practice. Stay tuned.
All right, so let's get started. What is yoga? Many of you may have a general idea of what yoga is from a class you've taken or from word of mouth through family and friends. Yoga is a mind-body practice that combines physical movement, breathing exercises, and meditation to improve overall function. There are currently numerous forms and styles of yoga, each with its own approach and techniques. Although yoga originated in ancient India, it has evolved and adapted significantly within Western cultures. Today, many occupational therapists use yoga in therapy to address the physical, emotional, and psychosocial needs following a disability, with adaptations such as chair yoga. So for the purpose of this educational video series, I won't go into too much detail about the history of yoga. However, for those interested in learning more, I have attached an article that provides further detail in the comment section below. In ancient India, early spiritual leaders utilized yoga to pursue inner contentment and external harmony. Patanjali, acknowledged as the father of yoga, advocated an eightfold path of yoga, otherwise known as the 8 limbs of yoga, which are yama, self-control, niyama, observance, asana, posture, pranayama, control the breath, pratyahara, control the senses, dharana, steady of the mind, dhyana, meditation, and samadhi, deep meditation.
So the literature predominantly discusses the advantages of using 3 out of 8 limbs of yoga in the management of upper extremity injuries and disorders. Therefore, later in this educational video series, I'll thoroughly examine how you can seamlessly incorporate these techniques within your hand therapy practice. But before I do that, I think it's important to understand the why and the how I developed the needs assessment for this capstone project.
As you may be aware, when managing upper extremity injuries, there are generally 2 scenarios. Clients who adhere to a standard healing timeline and progress through therapy as expected, and those who may experience delays in healing. These delays can often be attributed to local factors such as the presence of wound maceration and systemic factors such as age, diet, comorbidities, and stress. Research indicates that injuries or conditions affecting the upper extremity can have significant consequences on an individual's ability to carry out essential activities during recovery, impacting not only the physical, but also the psychosocial well-being of a person. And when looking deep into the literature, there is a consistent and positive correlation between higher levels of self-efficacy and return to work outcomes. Self-efficacy, defined as one's confidence or the belief about one's ability to achieve desired goals. In addition, the literature shows that low self-efficacy as a barrier to patient adherence in in-clinic exercise programs and home exercise programs, which could further delay recovery. This implies that psychosocial factors, such as reduced self-efficacy, significantly influence the return to work process for people with upper extremity conditions and injuries. Failure to address psychosocial factors may result in psychological distress. In addition, research has shown a high prevalence of mental health conditions among people with upper extremity conditions and injuries, including anxiety, depression, panic disorder, and post-traumatic stress disorder, which could potentially further hinder the recovery process for injured workers. Consequently, this evidence indicates that the functional limitations associated with upper extremity conditions and injuries in the United States may point to a potential gap in existing practice patterns within upper extremity injury management. So, hand therapy is the practice of rehabilitation to prevent dysfunction, restore function, or reverse the progression of pathology in upper extremity conditions involving the hand, wrist, elbow, and shoulder girdle. Both occupational therapists and physical therapists may specialize in hand therapy practice, and although the series could potentially be beneficial for both OTs and PTs alike, this series will specifically refer to those hand therapists who are occupational therapists. So, occupational therapy is rooted in the fundamental importance of holistic care. It aims to address both the physical and mental aspects to assist individuals in returning to activities of daily living and meaningful occupations. Therefore, certified hand therapists should aim to incorporate this holistic approach into their interventions for upper extremity injuries and conditions. However, it is well known among occupational therapists and within the literature that CHTs often receive criticism for straying away from a holistic approach when treating upper extremity injuries and conditions. In a survey of CHTs, nearly 90% of participants reported using the biomechanical approach with 50% of their clients, even though 39% of that 50% presented with psychosocial factors. A biomechanical approach involves using interventions to address limitations in strength, range of motion, and coordination. Such interventions include therapeutic exercises, home exercise programs, and orthotics, prosthetic interventions. This raises concerns naturally, particularly because occupational therapists should understand the impact of psychosocial factors on delaying recovery and healing processes. And there is literature supporting that hand therapists do make the efforts to integrate psychosocial factors that affect participation and recovery into the treatment. They oftentimes employ various techniques such as massage, visual imagery, relaxation techniques, mirror box therapy, therapeutic use of self, graded motor imagery, and narrative therapy, and so on. However, while CHTs acknowledge and endeavor to address psychosocial challenges in daily activities, they oftentimes encounter constraints such as time constraints, resource limitations, and limitations given by a medical condition or a treatment restriction. Which leads me to yoga. As a mind-body practice, yoga can complement standard hand therapy treatment, especially for clients with psychosocial factors that have a delay in healing. Through techniques such as pranayama, dhyana, and asanas all into one treatment. Evidence in the literature indicates that these techniques can aid in psychosocial adaptation by emphasizing pain management and promoting relaxation in the body, which reduces blood pressure, heart rate, and muscle tension, as well as improving breathing patterns and digestive function. Overall, aid in the recovery process for people with upper extremity injuries and conditions. Currently, many occupational therapists use yoga to bring context to therapy to address the physical, the emotional, and the psychosocial needs following a disability, such as yoga for neuromuscular conditions. Yoga is not commonly considered for treating upper extremity injuries and conditions due to its association with weight-bearing postures, which may contradict early weight-bearing precautions. However, the diverse techniques employed in yoga can be seamlessly integrated at various stages of recovery while still adhering to the upper extremity protocol healing. Throughout this video series, I will reference the literature that underscores the efficacy of yoga within occupational therapy practice for managing symptoms associated with upper extremity injuries, such as hand pain intensity, reduced grip strength, and motor performance. And for those interested in exploring this literature now, I've provided links to some of this evidence-based research in the comment section below.